As the Vice President of Northern Light Health for Government Relations, I represent all of our member organizations, our employees, and our patients on legislative bills that will impact healthcare, workforce, financing, education. A myriad of bills impact our organization. We know that we have a shortage of 2,250 registered nurses. And we know that our education partners throughout the state of Maine, whom we work closely with to produce the workforce of the future, need faculty. So faculty can have their loans paid off in exchange for teaching full-time for a minimum of 3 years. That's a big incentive for faculty to work in those environments. But think about who works in an emergency department today. It's our doctors and our nurses, it's security, it's dietary, it's lab personnel, it's housekeeping. There are a lot of people in our emergency departments, and I'm sad to say many of them are harmed. They're harmed by our patients and they're harmed by our families. And when we call law enforcement to report a crime, law enforcement is limited in many ways because of the construct of that law. So I took the stories, the powerful stories of our staff who had been harmed, and brought those stories and made them live here. And I told those stories when I testified on bills. And I told those stories when I spoke with members of the Senate and members of the House. And we partnered with the Maine Hospital Association and Maine Health to create legislation that would expand that felony level crime to all of our employees in the emergency department. As a health system, we know that there are children who are in our emergency departments for months. And when you drill down on the data, these children with the extended stays really need a special type of service, and it's community-based residential service. Sometimes it's a secure residential facility that doesn't exist in Maine, and other times it's the community-based residential services we have. So we put in 2 pieces of legislation. One, to direct the department to establish the rates and create that secure facility that we need in Maine. And that brings the department and their resources closer to the community providers to help them care for these children. If you think about this past session, we had over 2,000 legislative bills. 500 bills would have impacted Northern Light Health in some way. And a couple of hundred passed into law. So my work now is helping to translate those laws into our policies and practices to benefit our patients.